people with multimorbidity and complex physical and psychosocial conditions is fragmented. The aim of integrated care is to put together all the fragments from healthcare system and from the community which already exists.
Ker vemo, da zdravstveno varstvo ne more vedno urediti vse probleme pri pacientu, smo se v okviru tega projekta tudi povezali z Centrom za socialno delo in tako uvedle mesečne sestanke, skupne sestanke, na katerih obravnavamo problematiko, ki se pojavlja na terenu.
Mislim, da je pomembno, da pri zdravljenju kroničnih bolnikov nastopimo skupaj s kolegi kliničnimi specialisti, da vzdržujemo čim bolj tesno komunikacijo in da k zdravljenju pacienta nastopamo čim bolj celostno.
Ne vem dobro, odkot se je Krodis vzel, ampak tisto, kar se tam počne, ima veliko svetlo budočnost. Cel kup strokovnjakov in laikov pa uporabnikov bolezni si prizadevamo, da bi zdravstveni sistem, tak kot je, uporabljali na najboljši možni način, predvsem v smeri boljših izidov zdravljenja.
In our pilot action, we aimed to improve the prevention and the treatment of patients with type 2 diabetes on the primary care level, taking type 2 diabetes as an example of non-communicable disease. In this context, we organized and founded the National Diabetes Center on the third level, and this center was involved for education of more than 300 physicians and nurses. Also on the primary care level, we reinforced the diabetes care units, and for diagnostics, treatment and prevention on this level, and this way of organizing was very much appreciated by the people with diabetes. One of them is present here now with us. And altogether, the QCR tool was very useful for us because we could evaluate our strength and our weakness at any moment, redirecting our plan for the project activity.
Hello, I'm Maria Švajda from Croatian Institute of Public Health, and I'll tell you a few words about Croatian pilot. The main goal of our pilot was to improve the management of diabetes according to international standards. There are three most important outputs of our project: improved GPs' awareness and practice in diabetes monitoring, improved patients' understanding on the importance of yearly checkups, and harmonized diabetes information systems and coordination mechanisms according to international standards. We have used QCR tool for setting up the project, and it really helped us to structure the project, but also to handle our communication with very large number of partners. Thanks to the tool, we have managed to coordinate the group work, having constantly in mind our final goal: raising awareness about the importance of regular and good quality diabetes monitoring, both among GPs and patients.
Myself, this is Professor Christos Avopoulos. I am the head of the Department of Internal Medicine. This is the first medical propedeutic department of internal medicine in the University Hospital of Achapa University Hospital of Thessaloniki. In this ward, all clinical and educational activities of Prodis took place. This program was a great experience both for us and patients, since we had the chance to have a more close collaboration.
Good morning, this is Dr. Dimitris Kafanidis, Assistant Professor of Nursing. The CRODIS Plus project was both a great opportunity and challenge for clinicians and patients alike. Lessons learned from this clinical endeavor are already being incorporated in our current practice, and thank you for this opportunity again.
I'm Funduki Andivoni, Clinical Lecturer in Nursing. Patients who participate in CRODIS Plus program improve their skills in self-management.
Somalis, particularly women, have higher risk for type 2 diabetes. We created and piloted a culturally acceptable lifestyle intervention model to prevent type 2 diabetes among Somalis. Of the Joint Action CRODIS recommendations and criteria, our special emphasis was on target population empowerment. Our pilot intervention consisted of type 2 diabetes risk identification and a group and digital lifestyle counseling lasting for 12 weeks. We conducted the intervention in the mosque in Somali with help from volunteering healthcare students from the community. The participants increased their vegetable consumption during the pilot, and they intended to continue pursuing healthier lifestyle. The piloted model proved to be feasible in providing prevention interventions to this underserved, hard-to-reach population group. Key success factor was active involvement of the target community.